Medical students are often faced with the challenge of understanding the complexities of various medical conditions and their underlying mechanisms. In the case of diabetic retinopathy, a disorder that affects the eyes of individuals with diabetes, there are numerous factors at play that contribute to its pathogenesis. This script aims to provide a comprehensive overview of the various aspects of diabetic retinopathy, ranging from aberrant vascular permeability to genetic predisposition, and from neurodegeneration to ocular surface neoplasia. By delving into these topics in detail, medical students will gain a deeper understanding of the complexities involved in this eye disorder and its management. Diabetic retinopathy is characterized by abnormal blood vessel formation and disruptions in vascular permeability within the retina. This impairment in vascular function is linked to the development of retinal edema, a major cause of vision impairment in diabetic patients. The increased production of vascular endothelial growth factor, VEGF, by retinal cells is thought to be a key driver of abnormal vascular permeability. Additionally, inflammatory mediators such as cytokines and chemokines play a crucial role in promoting vascular leakage and exacerbating the progression of diabetic retinopathy. Inflammation plays a significant role in diabetic retinopathy and contributes to the neurodegenerative processes observed in this condition. Inflammatory mediators, including tumor necrosis factor alpha, TNF-alpha, and interleukin-1 beta, IL-1 beta, are released by retinal cells in response to high glucose levels and the subsequent activation of several intracellular signaling pathways. In turn, these inflammatory mediators contribute to retinal neuronal cell death and malfunction, leading to vision impairment. Advanced glycation end products, AGEs, are a heterogeneous group of molecules that accumulate in various tissues, including the retina, in individuals with diabetes. The buildup of AGEs contributes to the pathogenesis of diabetic retinopathy by inducing oxidative stress, inflammation, and altering the structure and function of retinal cells. Additionally, AGEs have been implicated in impairing retinal blood flow regulation, further exacerbating the progression of diabetic retinopathy. Diabetes affects the regulation of blood flow in the retina, leading to vascular abnormalities and tissue hypoxia. The dysregulation of vasoactive factors, such as nitric oxide, endothelin-1, and prostaglandins, in combination with the increased production of VEGF, contributes to vasoconstriction, vascular leakage, and the subsequent formation of new blood vessels. Understanding these alterations in retinal blood flow regulation is crucial for developing interventions to prevent or arrest the development of diabetic retinopathy. Chronic hyperglycemia and altered retinal blood flow can lead to the development of retinal ischemia, characterized by an inadequate supply of oxygen and nutrients to retinal cells. The retina responds to this ischemic state by releasing angiogenic factors, such as VEGF and platelet-derived growth factor, PDGF, which promote the formation of abnormal blood vessels. This neovascularization can lead to complications such as vitreous hemorrhage and retinal detachment, contributing to vision loss in diabetic retinopathy. Diabetic optic neuropathy is a common complication of diabetic retinopathy, characterized by the dysfunction and loss of retinal ganglion cells, RGCs. RGCs are crucial for transmitting visual information from the retina to the brain. The mechanisms underlying RGC dysfunction in diabetic optic neuropathy involve a complex interplay of oxidative stress, mitochondrial dysfunction, and inflammation. Understanding these processes is essential for developing targeted therapies to preserve RGC function and prevent vision loss. Diabetic macular ischemia, DMI, is a subtype of diabetic retinopathy that specifically affects the macula, which is responsible for central vision. DMI is characterized by the non-perfusion of macular capillaries, leading to retinal hypoxia and subsequent vision loss. The pathogenesis of DMI involves the interplay of various factors, including chronic inflammation, altered vascular endothelial growth factor, VEGF, signaling, and dysregulated angiopoietin Ti2 signaling. Diabetic retinopathy has emerged as an important marker and predictor of cardiovascular disease, CVD, in individuals with diabetes. Both conditions share common risk factors, such as obesity, hypertension, and dyslipidemia. Additionally, the microvascular changes observed in diabetic retinopathy mirror those occurring in other end organs, including the heart and kidneys. Understanding the link between diabetic retinopathy and CVD is crucial for comprehensive patient management and risk stratification. Genetic factors play a significant role in determining an individual's susceptibility to diabetic retinopathy. Genome-wide association studies have identified several candidate genes involved in pathways related to vascular function, inflammation, and oxidative stress, which could influence the development and progression of the disease. Understanding the genetic predisposition to diabetic retinopathy can aid in personalized risk assessment, early detection, and targeted therapeutic interventions. Individuals with diabetes are at an increased risk of developing ocular surface squamous neoplasia, OSSN, a spectrum of ocular surface tumors. Chronic inflammation, impaired immune surveillance, and alterations in the ocular surface microenvironment in diabetes contribute to the development of OSSN. Recognizing and managing OSSN promptly in diabetic individuals is crucial to prevent the progression to more aggressive forms of cancer and preserve vision. Given the complex pathogenesis of diabetic retinopathy, there is increasing interest in developing neuroprotective agents to prevent or delay the progression of vision loss. Various agents, including antioxidants, anti-inflammatory compounds, and growth factors, have demonstrated potential in preserving retinal neuronal function and preventing neurodegeneration. Understanding the mechanisms of action of these agents will help in selecting appropriate therapeutic strategies for managing diabetic retinopathy. Early detection of diabetic retinopathy is critical for initiating timely interventions and preventing vision loss. Advances in imaging techniques, such as optical coherence tomography, OCT, and fundus photography, offer high-resolution visualization of retinal structures, allowing for the identification of subtle changes associated with early-stage diabetic retinopathy. These innovative imaging tools enable clinicians to make informed decisions regarding treatment and patient management. In conclusion, diabetic retinopathy is a complex eye disorder that encompasses multiple pathological processes, ranging from vascular abnormalities to neurodegeneration and tumorigenesis. Understanding the intricate interactions between these factors is essential for effectively managing this condition and preventing irreversible vision loss. By exploring the detailed aspects of aberrant vascular permeability, inflammatory mediators, genetic predisposition, and several other topics, medical students can acquire the necessary knowledge and skills to diagnose, treat, and advocate for patients with diabetic retinopathy. As further research continues to unravel the intricate mechanisms of this condition, ongoing advancements in diagnostic imaging, neuroprotective interventions, and personalized medicine hold promise for improving patient outcomes in the future.